Corticosteroids are often used as a treatment option for people with lupus because they reduce inflammation and affect the immune system. Corticosteroids, most of which are synthetically made, are considered potent anti-inflammatory medications. Some patients may even hear the term glucocorticoid, favored by pharmacists to describe synthetic drugs that act like endogenous corticosteroids. When given in high doses, they can also be an immunosuppressive. Long-term use can cause steroid-induced diabetes. If you are diagnosed with this condition, you will receive standard treatment for diabetes. What is diabetes? When your body cannot properly regulate glucose, or sugar, in your blood and those levels become too high, then, most likely, you will be diagnosed with diabetes. Glucose, which comes from the foods we eat or is made by the liver, is an important source of energy for our body's cells. Insulin allows cells to take in glucose from the bloodstream. Without proper insulin action, glucose builds in the bloodstream and cells are deprived of energy. If you are diagnosed with type 1 diabetes, you cannot produce insulin. If you are diagnosed with type 2 diabetes, you do not make enough insulin to meet your needs. Over time, diabetes can lead to a number of serious health problems, including eye damage, kidney damage, nerve damage, heart disease, stroke. Symptoms attributable to type 2 diabetes. The most commonly diagnosed type of diabetes include fatigue, thirst, weight loss, blurred vision and frequent urination. But you do not have to present with symptoms to have diabetes. Some people have no symptoms. Blood tests can show if you have diabetes. Exercise, weight control and sticking to your meal plan can help control your diabetes. You should also monitor your glucose level and take medicine if prescribed. To determine whether you have diabetes, and what type, a healthcare professional will perform certain tests, including a fasting blood glucose test. This test is often conducted in the morning, or after an 8-hour fast. Glucose levels are determined and if they are above a certain index, then diabetes may be diagnosed. Another test is the oral glucose tolerance test, which measures glucose levels 2 hours after drinking a beverage containing 75 grams of glucose dissolved in water. Diabetes treatment. Taking insulin is the main treatment plan for those with type 1 diabetes. Prior to the discovery of insulin, type 1 diabetes sufferers would die within a few years. Insulin intake must be balanced with food and daily activities. Thus, patients with diabetes are encouraged to eat right and increase their physical activity. Patients must also regularly check their blood glucose levels, and take part in periodic hemoglobin A1C lab tests to measure glucose levels. Results of the A1C test reflect average blood glucose over a 2 to 3 month period. For type 2 diabetes, healthy eating, physical activity, and blood glucose testing are the basic management tools. In addition, many people with type 2 require oral medication, insulin, or both to control blood glucose levels. Above all, diabetes sufferers need to focus on day-to-day care to successfully manage their disease. Such care includes keeping blood glucose levels from rising too much or dipping too low. If levels drop too low, people with diabetes may find themselves nervous and confused, with impaired judgment leading to possible loss of consciousness. This condition is known as hypoglycemia. A person can also become ill if blood glucose levels rise too high, a condition known as hyperglycemia.